Next up, we have, we're very fortunate again to have with us from the Women Veterans Project two dynamic folks, Aloha Lani Bullock-Jones from the VA Center for Women Veterans, and also Ms. Shaka Lee, who's actually a project lead with the Veterans Experience Office. Aloha Lana and Shaka, are you here with us?
Hi, this is Aloha Lani. I'm here.
Thank you so much. I know it's getting late back there.
Hi, this is Shaka, and I'm here.
Hi, Shaka.
Hey, Shaka.
Hi, Jim.
Well, I'm going to go ahead and get started. Good afternoon or good morning. I'm not sure what time it is over there, but my name is Aloha Lani Bullock-Jones. I'm the Senior Program Analyst here at the Center for Women Veterans in Washington, D.C.
I'm sorry, are you able to speak louder? At least here in Spokane, we can barely hear you.
Can you hear me? Hello?
Yes, that's better.
Okay, much better? Okay. Let me see if I raise my volume up. Oh, it's raised all the way up. Okay, so I'll do my best to speak louder. Again, good afternoon. My name is Aloha Lani Bullock-Jones. I'm the Senior Program Analyst here at the Center for Women Veterans. We are office under the Secretary, and we're here at Central Office. Myself and Shaka Leah will be tag teaming on this presentation, so I'll start it off and then Shaka will come in. Next slide, Tony. We'll move to the next slide, thank you. So just to give you some background on the Center for Women Veterans, we were created by law, and it has a number of mandated functions, which includes advising the VA and other stakeholders on policies, programs, and laws related to women veterans. We disseminate information, and we support the Independent Advisory Committee, or the VA Advisory Committee on Women Veterans. I like to tell folks that, in essence, we ensure that VA is doing what we promised to do for women veterans. So we are an oversight office. We do not administer benefits or services, but we ensure that VHA, VBA, and NCA are doing what we promised to do for women veterans. Next slide, Tony. Tony, next slide. Thank you. As we can see here, women have grown from just over 2% of the force during World War II to roughly 15% of the total force today. Next slide. So, some demographics that we use is accordingly, women are one of the fastest growing subgroups of veterans. Our representation is expected to grow from roughly 9.5% to 10.5% in 2020. Compared to our male counterparts, we skew younger and more ethnically diverse. So as we can see, the median age for women veterans is 50 years old in comparison to our counterparts what the median age is at 65. Next slide, please. So people ask, why do we need to target women veterans, or why do we need a Center for Women Veterans? Sadly, women who try to own their veteran identity may not be treated with the dignity and respect they've earned. Here are a couple examples of times when women veterans have parked in spots designated for veterans at grocery stores and come back to find nasty notes on their cars because they don't meet the image people have in mind of what a veteran looks like. So when we are trying to reach women, overcoming these obstacles, lack of awareness of veteran status and associated benefits, and the possibility of having had negative experiences when they try to do so, means that we must explicitly target women veterans. So, in essence, we look at it as it's very important that we show women veterans and that we advise women veterans of the benefits and services that they've earned and deserve. In a few slides, I'll be sharing some innovative ideas or efforts that the VA, that Center for Women Veterans, have currently and will be implementing in the future But at this time, I would like to tell you about the trust, the VA trust by gender data that was found and why we need to examine women veterans care at VA and increase their trust. Next slide. So as we can see on this slide, women veterans trust of the VA is slightly lower than our male counterparts. This score was a breakdown by gender, and look at it as, you know, women veterans, sometimes they feel that the VA cannot provide the services that they need, and it's not because they have never tried the VA or have tried the VA, but it's because they've never come to the VA. So our goal is to increase the trust gender in comparison to our male counterparts. Next slide. And this is also a trending chart of the score by quarter. So as we see, we rate our trust by gender increased for female veterans in 2017, quarter 4 of 2017, but it also decreased in quarter 1 of 2018. So VA is examining why women veterans tend to not trust the VA in comparison to their male counterparts. Next slide. And this slide just gives, again, the trust factor by gender and by current quarter. And at this time, I'm going to turn it over to my colleague, Ms. Shaka Leo.
Thank you, Ms. Bullock-Jones. Thank you, Bob, Jim, and Tony for having me today. Next slide, Tony. I know it's getting a little late on the East Coast. We're going to try to move through this kind of quickly. So first I want to start by saying that as a service-connected female veteran that received care at the VA, I'm grateful that the Veterans Experience Office, in partnership with VHA's Women Health Services and the Center of Women Veterans, are working together to connect, understand, and design solutions to improve our experiences as we navigate the VA system. I'm also very hopeful that the VA is moving in the right direction to be more inclusive and to build trust with us women veterans so that we can improve care for us, as well as we can, when we can improve care for us as women veterans, we can elevate the care and standards of all veterans. So as Ms. Bullock-Jones indicated, women veterans are the fastest growing demographic group of veterans in the United States. They make up about 2 million or 9.5% of the 20 million living veterans today. And while the number of veterans overall are decreasing, the number of women veterans are increasing rapidly. This rise will place more demands for women veterans care services. Annual surveys indicate that women veterans have lower trust scores than men. To understand why, the Center of Women Veterans, the Women Health Services, and Veterans Experience Office team and partner to explore how women currently experience their care within VA. VEO took the lead and assembled the Veterans Experience Women Veterans Research Project team over a year and a half ago to understand and deep dive into the pain points and moments that matter most to women veterans through human-centered design interviews. And I will get into a little bit of what that means later, and workshops. So by helping to document what women veterans experience pain points along their outpatient care journey with VA, we can then work to provide customer-focused solutions. And so the outcomes of the research was a women veterans journey map, the Building Trust with Women Veterans storybook, along with accompanied with a video that identified some of the quotes that we heard from our women veterans. Next slide, Tony. So the women we spoke with across the country were very diverse. And when I say across the country, we spoke with over 200 women through again, our human-centered design workshops and interviews in D.C., Maryland, North Carolina, and Texas. We work closely with Dr. Patty Hayes in Women's Health Services, as well as the leadership of in the Center of Women Veterans which provided us with some statistical and survey data, specifically the barriers to care report, some of that data. So we took all that data and we teamed with our partner in Vision 6 to explore human-centered design workshops. And in these workshops, and we chose that location because the women, Vision 6 had 3 models of care in their women's clinics and had the most growing population of women veterans in their Fayetteville area. And so the women that we spoke with had an average age of 51, about 38% served in combat. There were 85% that saw a provider in women's health clinics. The other 15% saw providers in a primary care clinic. The average years served was a little bit over 10 years. We had every ethnic background that was represented at these workshops and interviews. And they were all, from when it comes down to military occupational specialties, or MOS, as us military folks call it, we had a range from finance to personnel records, logistics, dental techs. We had some chemical operations, drill sergeants, and we had enlisted and officers represented as well. Next slide, please, Tony. What we identified is every woman had a unique experience navigating the VA healthcare system, a different perspective and mindset from our men who utilize the VA healthcare. Many women arrive without knowing what to expect in regards to their care and how they would be treated by staff or what would happen after their appointment. The thought of the unknown can be challenging for women as they deal with their concerns of their health and well-being. Women that we spoke to, I would say about 80% of them had experienced military sexual trauma. So they already were vulnerable before they even made that first phone call to VA. And then once we identified roughly about 40% of the women that we spoke with provided us with their experiences of the cat calls and some of the harassment they experienced as they utilized the women's health clinics. And so they were very vulnerable before they came into our facility. And so as a result of this vulnerability, women veterans need VA staff to emphasize and to respond to their concerns at every touch point along their journey. Next slide. So gathered from the research for 5 themes. When we synthesized the data that was provided to us, women needed empathy, compassion, respect, and responsiveness from our staff at every step of the journey. There was a need to have a connection with their provider, healthcare team, as well as other women veterans. Women experienced an unequal care by facility, gender, and VA employment status. And I have to kind of go into detail about, because people, in reference to that theme, is because a lot of staff don't understand when we say, or auditors don't understand when we say by facility, gender, or VA employment status. And to give an example, we had one woman that was a VA employee who gave us her experience of when she called from her VA phone, she was able to get an appointment, or she was able to get services immediately. However, when she called from her personal cell phone, she was not able to get that same customer service or even get an appointment. So she felt because of her VA employment status, she was able to get their services based on. And again, this is her perspective, and a lot of times a person's perspective is their reality. So I just wanted to go into detail of what that actual thing meant. They also, women veterans also have specialty care needs of gynecological and mammography needs that are not easily addressed in the current VA structure. Lastly, women veterans are eager to be involved in the design of their patient experience improvements at VA, meaning that they didn't want to just complain about their issues and concerns. They wanted to be included in their care plans. They wanted to be included in the decisions being made by VA leadership or VA healthcare providers in their healthcare plans. The VE team provided immediate long-term recommendations at the facility, vision, and national levels to support each team. And of course, VE provided products and toolkits were also provided along with those recommendations. Next slide, Tony. This is the VA Women Veterans Patient Experience Journey Map, which is one of the outcomes of the research. And VA Women Veterans Patient Experience Journey Map represents the common set of moments that matter before, during, and after receiving care during an appointment visit. This map is a good start towards defining the ideal patient experience for women veterans. As part of the Human-Centered Design Workshop, we gave the women a blank patient veteran experience journey map and asked them to place a dot and explain that dot on the moment that mattered most to them. And as you can see on the journey map, where you see the black dot, if you can see it on your screen there, and Tony will have a copy of this journey map along with the storybook, along with the, some of the quotes that we heard from women veterans, if any of you in the audience would like to receive a copy, an online version. But as you can see on the journey map from the black dot, these are where the moments that mattered most to women veterans, which was before, during, and after the visit. Those pain points are where VA can focus our efforts to improve our trust. And as you can see, most of the dots lie in meeting with the provider. Next slide, Tony. Human-centered design is our approach that we use in VE, which kind of makes the Veterans Experience Office very different from other program offices, is that we use a very unique approach called human-centered design. Human-centered design, in the short term, it focused on the experience of the end user or the customer, and we design solutions based on that customer's feedback and that customer's experience. So instead of having a top-down approach, it is really a bottom-up approach. And again, we design customer-based solutions based on the customer unique experience. Next slide. This is some of the quotes that we heard from women veterans. Again, one woman veteran said, I want you, the provider, to treat me like a whole person, not just someone assigned to you. Another woman veteran said, I love my provider. She listens. She's attentive. She's not afraid to admit when she does not know or needs to consult. I can say, I have found this, and she'll say, oh, that's interesting. Let's see. And I like that she is open and that she thinks about the things in my care that I didn't even recognize or realize that I needed. Another woman veteran said, we women veterans are our best advocates. Let's look for openings. Let's look for ways to advocate. Let's make sure veterans are part of the solution. Again, these are some of the quotes that we heard from our women veterans. Next slide, Tony. So what's next? There were 10 actual next steps, design opportunities presented to the Center of Women Veterans, to VHA Women Health Services, which the VHA Women Health Services has agreed to work on one immediately. We actually have a project that is in the pipeline waiting for approval that will focus on how might we foster a more positive relationship between women veterans and their providers, and hopefully that project will come on board soon. But the other top three that were identified is how might we create a culture where women veterans feel equally respected as patients, and how might we set expectations where women veterans understand what services VA can offer them. Myself and Ms. Bullock-Jones, we sit on a committee called the Women Veterans Program, and we're also identifying solutions and toolkits to address the culture and to set expectations and more to build a more positive relationship and build trust between our women veterans and VA. Next slide. Okay, I'm going to kick it back over to Ms. Bullock Jones, and she can tell us how we foster trust with women veterans. Thank you.
Thank you, Johnson. So as I stated earlier, the Center for Women Veterans supports any type of initiative that will recognize women veterans or to increase women veterans' trust in VA. Next slide, please. But as we know, the lack of recognition isn't unique to the civilian community. As a VA patient myself, I have been called Ms. Bullock Jones or Mr. Bullock Jones by clerks looking at the computer who assume that the veteran that they're helping is a male. Parking lot attendants who have directed me to the employee parking lot because they did not know or did not recognize me as a veteran. But we also hear from other women veterans who said that they have the same similar experience or they've had similar experiences, and that's why we actively support campaigns like those that you see on the screen in front of you that are working towards culture transformation within VA to ensure all women veterans are recognized and treated in the with dignity and respect that they've earned. Next slide. The Center for Women Veterans also are exploring innovative ways to expand the culture change efforts that I mentioned earlier. Last year, we arranged to have storyboards of art by women veterans featured at 10 VA medical centers nationwide. In March of 2017, which was Women's History Month, and the 100th anniversary of the first woman opening enlisting in the regular military with the equal rank and pay, Starbucks, traveling to 3 or more VA medical centers monthly over the next year, was also partnered with us on this initiative. We did this partnership with a nonprofit organization called VAP, and that nonprofit is dedicated to fostering and promoting veteran initiatives throughout the United States. Similarly, next slide. Similarly, in 2018, we partnered with Team Red, White, and Blue in hosting the Women Veteran Athletes exhibit. This exhibit was to raise awareness of the existence, diversity, and resilience of women veterans among VA employees and male patients. We also wanted to increase health and wellness with veterans by exhibiting these exhibits throughout the VA medical centers around the United States. Photographer Air Force veteran Stacy Persall was our veteran of the Veteran Portrait Project, brought this project to the Center for Women Veterans, and we thought it was a wonderful idea to highlight women veterans in this initiative. We also received support from the VA Canteen Service, Comcast, and Semper Fi Fund. This campaign continues to travel throughout the United States to VA facilities and even nonprofit facilities who request the exhibit to be sent to them. Next slide. And this slide just shows two exhibits of women veterans. As you can see, the exhibit is diverse. It's age relevant. It's diverse in disabilities and branches of service. And if you were to see the entire exhibit, you'll be just impressed with the strength and the endurance, the bravery, courage that these women veterans have. We do invite you to visit our website to find out more about this initiative and to see the full exhibit. Next slide. And in the VA Central Office, in earlier part of 2018, VA supported what is called We Are Not Invisible campaign. This campaign is made up of women veteran employees within the VA Central Office. This this exhibit or this campaign continues to travel as well, and we're getting a lot of traction from VA medical centers across the United States requesting that we photograph their women veteran employees for display in their facilities. And so we are traveling to Cleveland next month, and hopefully we're making arrangements to travel to Oregon sometime in early part of next year to photograph those women veteran employees in the VA facilities there. And I do want to caveat one slide back, and I failed to mention that if you are interested in having either the Women Veteran Athlete exhibit or the Veterans Artist exhibit travel to your location, whether it's a nonprofit, your church, or any organization that you may be involved in, we'll be happy to make that happen. You'll just have to contact us at our website, and that address will be provided to you at the end of this presentation. Next slide. The Center for Women Veterans is also on social media. So we encourage you to visit us on Facebook, like us on Facebook, follow us on Twitter. I'm not that much of a Facebook or Twitter person, but we definitely encourage you to follow those pages and find out what's the latest and greatest in the Center for Women Veterans. And last but not least, our contact information. If you do have any questions, next slide please. If you do have any questions, and like I mentioned earlier, if you would like that either exhibit to travel to your facility, or if you're interested in hosting a I Am Not Invisible campaign, we will definitely help you to make that happen at your organization, your office, etc., your business. Just contact us at 00w@va.gov, and Shaka has her contact information as well, and Sarah Hughes' contact information is there available to you. Are there any questions for us at this time?
I just had a real quick question from the Spokane area. I went to the Air Force Academy last week, and I saw a tremendous, when I went to the Air Force Academy, it was about 15% of the population were females. Do you know right now currently what the recruiting, how many male-female ratio it is right now? Because it is a lot more females that are being recruited into the services, correct?
I can certainly speak on behalf of all of the service academies. It is 25%.
25%.
25% of service academy entry will be females.
Okay. Thank you. Thank you for the presentation.
Aloha, Lonnie and Shaka. Just an observation from early on in your wonderful presentation. There was a slide that really caught my eye. Female veterans, I think, average age 50. Male veterans, average age 65. If I saw that right. That coupled with the stat that Jim just cited, and with regard to the percentages of the academies, and I'm sure it's similar at other entry points into the military. That obviously has tremendous implications for VA and all service providers, states, counties, etc. Any comment on that, and maybe you've already pretty much covered it, but.
I'll answer that, Shaka. So, and you're absolutely right. If we're looking at the median age of 50 for women veterans and an increase in women joining the military, we predict that the population or median age will actually decrease. Because we do find now that we do have a high number of women veterans separating from active duty that's of reproductive age, and this is why VHA or the women health services are actively engaging in maternity services, infertility services, and I'm not sure if anyone has heard, but VHA sponsored and hosted several baby showers around the United States at VA medical facilities. So with that said, yes, definitely we will see a trend of the population or the median age of women veterans decreasing to probably a younger age, when they discharge. But the numbers that we know of are the women veterans who are utilizing VA for their care and services. And we do see that age group is a little bit higher. That median age is older than younger. Not sure why younger women veterans are not utilizing VHA as high as older women veterans, but we can predict that it's probably because older women veterans, with insurance and Medicare age, the VA seems to be the most reasonable place of care, whereas younger women veterans do have options and access to private health care. So that's a prediction of why.
Thank you for that insight and assessment and overall outstanding presentation to both you and Shaka. Really appreciate it.